Welcome to my spotlight on concussion and academic performance. My name is Isabella Hockett, and I am a peer health educator for Bronco Fit. I chose to do my spotlight on concussion because I have endured multiple concussions and am passionate about bringing awareness to this topic. Throughout this presentation, we will be learning about what a concussion is, prevention, signs and symptoms, what treatment and management looks like, how concussion may affect academic performance, and resources that you may utilize for help. What is a concussion? A concussion is a type of traumatic brain injury, also known as a TBI. It is caused by a bump, blow, jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. According to the Cleveland Clinic, motor vehicle accidents, falls, and sports injuries are common causes of concussions. Any sport that involves contact can result in a concussion. Here are some ways that you can prevent a concussion. One important strategy is wearing a helmet. The Cleveland Clinic says to wear a helmet that fits when biking, riding a motorcycle, skating, skiing, horseback riding, or playing contact sports. A helmet should be secure and not move when you shake your head, but not uncomfortably tight. The Cleveland Clinic also suggests strengthening the neck muscles. They say that strong neck muscles may be able to help absorb some of the impact of blows to the head and decrease the risk of concussion. Some other great ways to prevent a concussion include always wearing a seatbelt, putting non-slip mats in the tub and shower, improving lighting, and removing tripping hazards. It's important to take precautions to prevent concussions. Next, we'll look at some signs and symptoms that may occur if you or someone you know endures a concussion. Everyone experiences the symptoms of a concussion a little differently, and there are many different symptoms you may experience. First, we'll look at some of the common observed signs of a concussion. These would be signs that you notice with someone else's behavior, not necessarily your own. These include not being able to recall events prior to or after a hit or fall, appears dazed or stunned, forgets an instruction, is confused about an assignment or position, or is unsure of the game score or opponent, moves clumsily, answers questions slowly, loses consciousness, shows mood, behavior, or personality changes. Next, we'll look at some of the common reported symptoms, and these would be symptoms a person who is concussed would experience and report themselves. These include nausea or vomiting, balance problems, dizziness or double or blurry vision, bothered by light or noise, feeling sluggish, hazy, foggy, or groggy, confusion, concentration, or memory problems, or just not feeling right or feeling down. These symptoms can really affect someone, and it can be difficult to navigate. It can also be difficult for others to understand what's going on. Remember to be patient, give grace, and offer support to someone who may be struggling. Concussion is an internal injury, so it can be difficult to see and comprehend what someone is going through because we can't see the injury directly. So we've gone over some of the observed and reported signs and symptoms, and now we're going to look at some of the red flags. While all signs should be addressed by a medical professional, the following danger signs should require immediate emergency medical care. Some red flags include one pupil being larger than the other, drowsiness or the inability to wake up, a headache that gets worse and doesn't go away, slurred speech, weakness, numbness, or decreased coordination, repeated vomiting or nausea, convulsion or seizures, unusual behavior, increased confusion, restlessness, or agitation, or loss of consciousness, and even a brief loss of consciousness should be taken very seriously. Again, emergency medical care should be called right away if you or someone you know experiences any of these signs. We've looked at some of the signs and symptoms someone may experience, so next we'll look at how to navigate the recovery process. There are 4 important steps in the recovery process. The first step is rest. It's important to limit cognitive activity for 3 to 5 days. This is a guideline, and it's important to listen to your body and do what's best for you. Make sure to get good, restful sleep and take plenty of naps. Sleep helps the body recover and heal. It's also crucial to avoid any activities that could risk injury again. The second step is light activity. This could include light house chores or going for a walk. Make sure to check in with your body and take breaks when needed. At this time, you can also start gradually returning to school. This may look like going for half days at first, then slowly and gradually going more often. The third step is returning to moderate activity. You can start working to return to a normal routine. It may not be perfect at first, and you may need breaks. It's important to take breaks, especially if you feel symptoms worsen. The final step is returning back to regular activity. The tricky part about this step is that regular activity may look different after a concussion. Make sure to do what's best for you and your body. This process is going to look different for everyone, and it's difficult to put a time frame on it because it truly depends on the individual. If someone doesn't recover after these steps, there are other options to help with recovery. Medication is a common treatment and is often prescribed for persistent headaches. According to the journal Child's Nervous System, headaches occur in approximately 85% of patients with a sport-related concussion. There are many types of medications used to treat headaches, and it's important to work with a medical professional to figure out what medication is best for you, or if it's needed at all. If you or someone you know is experiencing vertigo and dizziness, vestibular rehabilitation therapy may be the best treatment. According to the American Journal of Medicine, vertigo or dizziness may result due to an injury to the vestibular structures in the ear. Cognitive rehabilitation therapy may also be a good treatment for patients with persistent cognitive difficulty. The American Psychological Association states that cognitive behavioral therapy is a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression and anxiety disorders. The recovery process is crucial after injury. It's important to take the necessary steps to be able to fully recover. Make sure to work with a medical professional to figure out which options are best for you. There are many local resources in the Boise area to seek out treatment, and we'll look at a few of them. Boise State Health Services offers sports medicine services on campus in the clinic. These services are available to all Boise State students, staff, and faculty. The Idaho Sports Medicine Institute also offers a wide range of services related to sports injuries. St. Luke's Concussion Clinic is another great resource. They offer a range of services, specialties, and outreach and education. Throughout the recovery process, and even after recovery, academic performance may be hindered. This can feel very frustrating and be difficult to navigate. Some of these struggles may include increased time spent on homework, headaches interfering with learning, failure to complete schoolwork, difficulty concentrating and comprehending reading materials, and increased sensitivity to light, including computer screens. It's important to be patient and give yourself or others grace. We all have our own struggles and everyone experiences things differently. Healing from a concussion can be difficult in general, and being a college student offers its unique challenges. Some of these challenges include sleep disturbances. If you're living in a dorm or apartment, loud noise can be common. This can make it difficult to fall asleep or stay asleep through the night. Alcohol and drug use may also affect the recovery process. It's important to refrain from alcohol and drug use after a concussion because it can be dangerous. According to Banyan Treatment Centers, substance usage can worsen symptoms, lead to further injury, or trigger a seizure. Changes in relationships can be difficult during recovery as well. Many students may not have the direct support of their parents and family, so that may lead to feelings of loneliness and anxiety. College is also a time where friend groups are always changing, and navigating through this time can be tough, especially if you don't have a close friend for support. School obligations may also add more stress, on top of working to recover. Being a part of a club, group project in class, or sports team can be difficult after a concussion. The responsibilities tied to these obligations can be difficult to juggle on top of class, personal life, and most important, recovering. All of these challenges can be difficult to overcome and may add more stress, so it's important to seek academic support to help alleviate some stress. The Educational Access Center on campus is a great resource for academic support. They help create accommodations for classes based on the specific needs of the student. They're also there to help advocate for students and their needs. To contact them, you can call or send an email. For more information, please visit their website. Recovering from a concussion may present many challenges. Please seek out medical and academic support to help with recovery, and remember to advocate and take care of yourself. Thank you so much for listening, and I hope this helped.